Welcome back to Jersey Matters. I'm Larry Mendte. Huge news out of Rutgers University, where they're conducting several studies on COVID-19. One of those studies shows a big reduction in the number of cases among hospital workers. Here's the man that's running that study, Dr. Reynold Panettieri from the Rutgers Institute of Translational Medicine and Science. Doctor, as always, thank you for being so generous with your time. I appreciate it. I know you're busy. Rutgers is busy. You have several studies going on. You have one that you're overseeing. Can you tell us how things are going? Is there any news coming out of that?
Yeah, Larry, there's lots of excitement around the COVID research at Rutgers and across all of New Jersey. What we're finding is dramatic decreases in the infectivity for SARS-CoV-2. We just completed 2,600 healthcare worker screenings and could only find 2 positives. This is great news. Now remember, these healthcare workers are frontline. They're getting exposed to patients with COVID-19, but despite those exposures, we're seeing a dramatic decrease. Why? Good hygiene, social distancing has profoundly been effective. We don't have a vaccine and we have no therapies. That's what we're hoping for because we anticipate a surge come October.
So what we can take from your early positive findings is just keep doing what you're doing?
Yes, absolutely. Don't let our guard down. The single most important thing to do is good hygiene. It works. So please, I mean, in the hot summer's day, we want to take a break. We want to go have fun. That's fine, but please do it safely because we have curbed this crisis, this menace, only because of good hygiene and social distancing. I think vaccines are going to be occurring. We're going to be participating in several vaccine trials across New Jersey, so we're excited about that. And they're getting started months earlier than we anticipated. If everything works out well, we may have a vaccine by the close of this year and very early in 2021. That's going to be a game changer.
That'll be record breaking, right? We've never had a vaccine that quickly.
Never ever. And, some of this has been the government allocation of funding. Some of this is pharma, which is often competition, have joined together to work towards really developing vaccines quickly. NIH is serving as the platform for this commercialized vaccine trial. So several companies are working in concert with NIH. We're one of the sites that are funded by NIH. So this is really unique. This is a federal industry collaboration in the development of a commercialized product.
On a daily basis, it seems like you have findings from studies, some that conflict with each other, many that conflict with what we thought about this early on. How do you make your way through it? They come from some of the most prestigious universities, scientific research and publications, and yet you look at it and you say, okay, am I doing this wrong? Who do you go to? Who do we listen to?
Well, I think what you have to do is read with a critical eye all the literature that comes out. It's mind-boggling for the public who may not be informed in the nuances of clinical trials. Each clinical trial, frankly, Larry, is almost a snowflake. They're unique. They have unique characteristics for inclusion and exclusion. So one study may not equal seemingly the same study done in another institution because the nuances in the population studied are different. I think what you need to do is be able to integrate these and to look at the collective data. Hydroxychloroquine is a perfect example. I mean, it came out touted to be critically important in preventing disease. What we find is that it's ineffective, or if not ineffective, it could actually be harmful in some individuals. Now, no one would have predicted that. The first couple studies looked to be resoundingly beneficial, but subsequent studies done with more rigor and more transparency didn't confirm those results. Science is iterative, as well as purifying. That means when you don't have the right answer, we'll find it out eventually.
What about, you hear vitamin D, you hear zinc. Should people be taking that?
Well, you know, vitamin D is very important as an as an antiviral and antibacterial agent. I think vitamin D in modest and conservative concentrations is healthy. So I would say, you know, it could be beneficial. Is it a true treatment for COVID-19 or SARS-CoV-2? That's unclear. But for good health, I think it is. Zinc is very important, not only as an anti-infective to make the immune system more robust to fight infection, but it is also helpful, frankly, for heart function. So in moderation, these therapies are very beneficial. But as a primary therapy against COVID-19, we need a whole lot more data to support that.
One of your specialties, your specialty, one of the tops in the country, is asthma. And I have a son with asthma, so I'm very interested in articles about asthma. And one of the things I read is that there was some studies that showed that people with a type of asthma may resist COVID-19 better than others, which is mind-blowing and game-changing for someone that has a child with asthma.
Yeah. Matter of fact, Larry, I have an editorial that'll be published in the Journal of Allergy Clinical Immunology this month that actually highlights that paradox. Here we have patients with asthma. You would think they'd be ultra sensitive to infection with COVID-19. And what we find is actually, in some instances, it's protective. What we find is people who may have lapsed in their use of asthma meds have markedly embraced asthma therapy better, and they've gotten better. So, you know, here's an instance where a crisis drove people to take the medicines as prescribed, and indeed the medicines work. So, you know, in the case of asthma, we have not seen a huge uptick in patients with asthma developing COVID-19. That's really thrilling. It may actually be some of the medicines retard the virus from replicating and growing.
Doctor, we never seem to have enough time. I have 100 more questions, so if you don't mind, we'll keep checking back in on you. Is there, I think we hit most of the big things. I just want to make certain for our viewers, is there something you really want to tell people about COVID-19 that I didn't get to?
Yes, I really want to highlight one thing, Larry, and that is the reason we are successful, the reason we can consider reopening the country, New Jersey, and your homes and towns is because of good hygiene and social distancing. Don't let your guard down. We are winning because of that simple approach that is so very effective.
Thank you, sir. Appreciate it. Always love talking to you. I hope to talk to you again soon. That was Dr. Ray Panettieri from the Rutgers Institute for Translational Medicine and Science. Still to come, more big news out of New Jersey when it comes to COVID-19. A biotech company in the state has found a new test for the COVID-19 antibody. We'll talk to one of the vice presidents of GenScript when Jersey Matters comes right back.